Hi everyone, welcome to the Data Coach. My name is Lindsay, and this week's video is going to be a little bit different than what we normally do. So by the time this video is posted, the Nonprofit Technology Conference in Baltimore, Maryland will be well underway. I was supposed to give this workshop at NTC this year, but unfortunately, due to some health issues and a surprise surgery scheduled for next week, yay, I will not be able to attend. But I had already done the work on the slides and the exercises and blah, blah, blah. And I didn't really want to let the workshop go to waste. So instead, I've adapted it a little bit and presented to you here in a more webinar style format. So without any further ado, let's talk about applying trauma-informed principles to workplace cultural assessment.
Okay, hi everyone. Welcome to Applying Trauma-Informed Principles to Workplace Cultural Assessments. Let's get into it. So here's our agenda for this webinar. I'll start with some introductions. Next, we'll get into what trauma is and why it should matter to those of us in the nonprofit sector, not just on an individual level, but also understanding what trauma can do to an organization. And then finally, we'll get into our trauma-informed research principles and some practice examples that you can use for your next workplace cultural assessment. So who am I? Hi, my name is Lindsay Morgia. I'm the founder of the Data Coach, and the mission of the Data Coach is to empower nonprofit organizations with the data tools, skills, and confidence that they need to make their greatest impact. We do that in 3 different ways. We provide project-based services, so if you're doing a needs assessment, a program evaluation, you're designing a survey to get feedback on training programs, whatever it is, we can help you with that. We also do data management services, so that's conducting data audits and doing data strategy planning, making sure that you're collecting and analyzing the right data to help you track your progress and meet your mission. And then finally, education and training, like this. All the videos that we have up on our YouTube channel, our social media channels, other free stuff on our website, and we also do custom trainings, either in person or online, for nonprofits. Before going independent, I spent about 15 years in the nonprofit and public sectors, usually being the one data analyst in the office. I'm sure some of you can relate to that particular position. Over time, in working with partner organizations, I kept seeing the same need. There were a lot of nonprofits who wanted to do more with their data. They wanted a data person on staff, but they just didn't have the resources, the time to bring somebody on board to do all that. So my goal for the Data Coach is to really fill in that gap and be the data support for nonprofit organizations that, for whatever reason, aren't able to do it on their own. But what, you may ask, does this data nerd know about trauma? So glad you asked. Not to brag, but I have both professional and personal experience. We don't have time to get into the personal. Just know it made me funny. Professionally, I've done a bunch of work in the child welfare and juvenile justice spaces. I was the lead researcher for the statewide Massachusetts Childhood Trauma Task Force. As a part of that project, I created, implemented, led a survey about trauma-informed service providers throughout the state, because at the time we did not know how many there were or what those providers considered to be trauma-informed. Also did a big analysis about what trauma-informed care looks like across different sectors: healthcare, education, juvenile justice, others. And we brought all of this data together to create a framework for Massachusetts to become a more trauma-informed state. So before we jump into our principles and our practices, let's get a collective understanding of what trauma is. So according to our friends at SAMHSA, that is the Substance Abuse and Mental Health Services Administration, which I'm assuming still exists at the time of this recording, trauma is defined as the 3 E's. So an event or series of events or set of circumstances that is experienced as physically or emotionally harmful or life-threatening, and that has lasting effects on the individual's functioning and their mental, physical, social, emotional, or spiritual well-being. So it's a pretty broad definition. It's important to remember that 2 people may experience the same event, say a death of a family member, and have profoundly different experiences and effects. There may be one person in the family who's not affected at all, while there are others who may experience deep, complex grief, depending on the nature of their relationship with the person. I say that to remind us all that we can't make assumptions about whether someone else has been traumatized just because they experienced an event that we think would traumatize us. So we need to be really careful about our assumptions about what people have been through, what they're experiencing, and what those effects may have been. What kinds of events are potentially traumatic? Now, some of you watching this may already be familiar with the ACEs study, but just in case, in the early 90s, the CDC and Kaiser Permanente did a study on mostly older white people to better understand the connection between experiencing what they called adverse childhood events and health outcomes. And when you do experience adverse childhood experiences, there are implications for physical and mental health that can even lead to a shorter lifespan. ACEs include physical, sexual, emotional abuse, physical and emotional neglect, witnessing domestic violence, substance abuse in the home, and more. I think there are 10 total. Since that study, researchers have built upon it and really expanded our understanding of what could potentially be a traumatic event. Things like natural disasters, war, living in poverty, experiencing racism, and have found pretty similar results that experiencing these type of events can lead to negative short-term and long-term physical and mental health outcomes. So why should this matter for those of us in the nonprofit sector? Well, according to the CDC Behavioral Risk Factor Surveillance System, almost 2/3 of American adults have experienced at least one ACE, and about 17% experience 4 or more. The more ACEs that you experience, the higher your risks are. High-risk groups include women, we're a pretty female-dominated sector, and adults between the ages of 25 and 34. So what that means is a lot of adults are showing up to work with at least one traumatic event in their past, and that's just from childhood. Never mind the number who have gone through something traumatic as adults or something traumatic outside of the CDC definitions like living in poverty or experiencing chronic racial bias. Now again, experiencing an event doesn't mean a person is traumatized, but these experiences can certainly shape how we show up to work, how we communicate with other people, and how we do or don't express our challenges and concerns to others. Second reason why this matters for the nonprofit sector is that folks who work in this sector run the risk of secondary traumatic stress, which is also called vicarious trauma. This happens when we work with populations that have experienced trauma and we are repeatedly exposed to their stories and experiences. So just as an example, at one of my past jobs, I was tasked with reviewing a lot of reports of child abuse and neglect in the state child welfare system. Reading these stories over and over again definitely had an effect on me and how I was sort of navigating my place, navigating the world within the context of my job, but also outside of it. People like healthcare professionals, educators, counselors, social workers are generally high-risk groups for secondary traumatic stress. And the symptoms of that are pretty similar to what we might call burnout. So things like fatigue, things like exhaustion, mood changes, anxiety, and isolation. And then finally, the last reason this matters for nonprofits is because, like anywhere else, nonprofits can have really shitty workplace environments. High stress, high passion, few resources, low pay, chronic stress can all add up to being in a straight up dysfunctional organization. I found this really interesting article by Pat Vivian and Shanna Horner. It's a little on the older side, but it's about traumatized workplaces, and they use a rural nonprofit organization as an example of what this can look like. And these are some of the examples they use to explain what might cause dysfunctional patterns in an organization. And you can see if any of these sound familiar to you. They had suffered from a variety of harmful situations and events, death of a leader, sudden loss of significant funding, abusive leadership actions, cultures of meanness and blame, widespread undiagnosed secondary traumatic stress, rapid and sudden turnover, etc. Harmful conditions were so pervasive and deep that entities ended up with cultures organized around a set of dysfunctional dynamics. So, what are the potential impacts of a traumatized workforce and workplace for the nonprofit sector? You get fear, distrust, and cynicism among staff, poor communication, burnout, high turnover rates for nonprofits, and we know this is an issue sector wide. It could also negatively impact the reputation of the nonprofit organization. People talk. They hear about the places you don't want to work for from their friends, from their colleagues, and it's hard to attract the best talent if people see the organization as dysfunctional. You get increased costs related to recruitment and to hiring, and perhaps most dangerously, an acceptance that the dysfunction within an organization is normal. This is just kind of how things are. And that makes it really challenging to break cycles of behavior. It's very similar to being in a dysfunctional family. You might not realize that the dysfunction is abnormal, it's just kind of the way things are, making it hard to break those same cycles of behavior. But wait, you, watching this very webinar, are a responsible nonprofit leader, and you're looking around your organization and you see that morale is not great. You want to collect data on staff members' experiences, their expectations, their ideas for improving the workplace environment. But how can you build a plan that both encourages honest participation and avoids exasperating current issues and avoids re-traumatizing people and potentially causing more harm than good? You're going to do it by applying trauma-informed principles to your workplace cultural assessment process. Now, the 6 principles of trauma-informed research are adapted from SAMHSA's principles of trauma-informed care, which were aimed at giving care organizations like human service organizations, hospitals, other healthcare providers, giving them guidance about how to interact with patients who may be potentially traumatized. Researchers have since adapted these principles to apply to project planning, to data collection, analysis, and sharing information. We're going to talk about each of them, and then I'll share some examples with you of what it looks like to put the principles into practice in the context of that workplace cultural assessment. So our first principle is safety. Safety is how we keep our participants both physically and psychologically safe during our research process. Psychological safety is about creating an environment where people are able to express their opinions, their insights without fear of any kind of consequence. And you can see how in a workplace culture context, your staff, your board members, your volunteers might be afraid of consequences or retribution if they say anything negative about their colleagues or organizational practices, especially if trust between colleagues and trust between staff and the organization is a little tenuous. So, what are some things that we can do to increase their sense of safety? One of the first things you can do, or a big one, especially for evaluating workplace culture, is explaining to your staff, your volunteers, how you're going to keep their responses private, safe, and away from people who should not be seeing them. One way to do this is to talk with your staff and board and volunteers about keeping their responses anonymous or confidential. So what's the difference? Anonymity means that you aren't going to collect any identifying information from your participants. So if you're doing a workplace culture survey, you can keep it anonymous by not asking for anyone's name, location, department, job title, or other information that might reveal their identity. If you're keeping responses confidential, that means you are collecting some identifying information, but no one outside of your team will have access to that data. So confidential information is often collected in interviews and focus groups. You might have a list of participant names, but your job is to make sure that the only people who see the transcripts from those conversations are people who need to see it for analysis purposes. So that's one way to increase psychological safety. Another way to increase physical and psychological safety is to make sure you're hosting things like interviews and focus groups in accessible spaces. Ask people what they need and do your best to accommodate. And then finally, it's always a good idea to have a safety plan in place in case a staff member or volunteer becomes triggered or needs some extra support during this process. We never know what might upset people or what they're going through at any given time. So even if it's as simple as a reminder of the mental health services available through your organization's insurance, it shows your staff and team that you care about them and their needs, and that can help build a sense of safety and actually start to rebuild trust between staff and leadership. Okay, next, trust and transparency. Trust and transparency is about incorporating clear communication into our processes to build trust with our participants. It is okay to be repetitive. No one is thinking as much about your project as you are. People forget things, there's 1,000 other things going on. Clear communication can lower the anxiety around the process. Again, especially if staff is already struggling with stress, overwhelm, burnout, this is really important. To start, be sure to give your teams advance notice of whatever project you're working on. So for a workplace culture assessment, you'll want to let staff, volunteers, and whoever else know A, when the project is going to start, B, the purpose and the goals of the assessment, expectations for participation, and timelines for start dates, report backs, and completion. You could do this a month out, 2 months out, use your judgment. Just don't drop this on staff a day beforehand and then expect them to be available for interviews the next day. Be mindful of their workloads and their other obligations. Also be sure to give people plenty of time to schedule interviews or take your surveys so again, they can plan accordingly around their other responsibilities. And finally, always remind your participants what data you're collecting and why throughout the project. When your staff and your volunteers have a shared understanding of the purpose of this project, it can help motivate them to complete their tasks as soon as they are able. So a lot of times in any kind of research project, there are the experts and then there's everyone else. And we assume that the experts have all the right knowledge to plan, to implement, and communicate the results of the project. But in trauma-informed work, we value the lived experiences of our participants as much as the more academic knowledge of our experts. So that's where collaboration and mutual respect come in. How do we find opportunities to level the playing field and give participants as much say in the project as our experts and our leadership? There are lots of ways that we can do this. So in the workplace culture context, you can create a planning committee that includes some staff and volunteers so that they have an opportunity to share their ideas for planning, for execution, and for next steps after all of the research is complete. They're going to have a lot of valuable knowledge about what's going on the ground and can really help shape the assessment process in a way that makes it work for both leaders and staff. If you're going to be asking questions through surveys or interviews, ask some staff members for their feedback on those questions. Do they make sense? Is there anything else that should be added or dropped? And then finally, make sure that, out of respect, we are limiting our questions to professional experiences, not personal ones. Even if you suspect that your organization has a traumatized task force, it is disrespectful to flat out ask people about past personal traumatic experiences in their lives. Set boundaries, stay in your lane. If someone voluntarily shares something with you, that is one thing, but directly asking people about their past trauma in their childhood, not respectful. Don't do that. Empowerment, voice, and choice. So historically, research has been a lot about taking time, taking resources, taking information, without providing anything in return or considering participants' feelings on the matter. To correct for some of that past practice, we now incorporate this principle of empowerment, voice, and choice, which allows people to have a sense of autonomy and control over their participation in a project. So what does this look like in practice? One is informed consent. So this goes back to telling people what you're going to be asking about, how you're going to be using that information, and how you're protecting their privacy. Yes, even for internal projects like a workplace cultural assessment. This is why this is in capital letters. Informed consent processes give people an opportunity to ask questions about the process or say no to participation altogether. Remember, you are not owed participation by your staff and volunteers. Make sure that everybody knows they have the freedom to choose their level of participation. Also, make sure that staff and volunteers know that they don't have to answer every single question on your survey or in the focus group. They can respond to the ones that they are comfortable with. And then finally, be sure you're giving people options for participation. Do you want to do this interview in person or virtually? Do you want to keep your camera on or off? When I do virtual focus groups, I always encourage folks to use the chat box if that's more comfortable, and to email me afterwards if there's anything they wanted to add or clarify after the session is done. I found that this works really well for, folks who are simultaneously dealing with childcare, for participants with disabilities, and for neurodivergent folks. Give people choices. Cultural humility and responsiveness is about the steps that you take before, during, and after a project to understand participants' cultural backgrounds and social identities. Our backgrounds and identities influence how we show up to work every day, and acknowledging that leads to a more inclusive, respectful evaluation process. So some practice examples include being mindful of the kinds of language that we use in our questions. If you're not entirely sure how to ask about gender identity in a respectful way, do a little bit of research before you design that particular survey question. Another thing you could do is, in general, just keep your demographic questions really open-ended so that people can describe their own identities without feeling limited, having to check off a box. And then finally, we can keep a really non-judgmental, flexible approach in our interactions. We're not here to judge people's reactions to their workplace environment. What we might think is too harsh of a criticism, or we don't like the way that someone phrased something, is irrelevant. Our job, as much as possible, is to remain neutral and create an environment where people feel comfortable and safe expressing their feedback. And then finally, we have peer support. So this is the spot where the principles overlap a little bit. Peer support functions a lot like collaboration and mutual support. It's again about finding those opportunities to make sure that our staff and our volunteers don't feel like subjects in a study, but more like active participants in a collaborative project aimed at improving the environment for everyone. So examples, you can decide to choose peers as facilitators for interviews or focus groups. You can ask for staff volunteers. Just make sure that they're trained well and make sure that you are aware of power dynamics. So don't ask the director of a department to interview all of their subordinates. That's going to influence how people answer questions, and you might not get the most honest feedback back that way. Again, respectful, active listening, asking follow-up questions, showing people that we are interested and we care about what they're saying, and again, keeping that non-judgmental approach. There are always risks when we participate in any type of research project, no matter how formal or informal. In the workplace assessment context, staff and volunteers may be worried about how their feedback will be received or what might happen if a supervisor or a colleague finds out about what they said. And there's also the risk of getting triggered or feeling re-traumatized depending on what kinds of questions we ask and how we ask them. Nonprofits should look at trauma-informed principles as a guide that will help us mitigate these risks and help us build trust again, especially if trust between colleagues and departments is fraught. So use these principles as a guide, help to reduce harm, think about risks and benefits and strategies that you can use to, again, lower those risks and get the best information possible to improve your workplace culture. Okay, and now it's time for, hold please.
Hi there, me again. So normally, if we were doing a live webinar or a workshop, this would be the moment that we would start our Q&A round. However, we're not live, obviously. So if you do have any questions or comments about what you've seen in the webinar, please feel free to leave those below, and I will get back to you as soon as I am able. As always, the Data Coach is here to help you and your nonprofit with all of your data-related needs. I encourage you to please visit our website, the-data-coach.com, to learn more about our services. You could take our free data health assessment to get some guidance on data management, and you could also schedule a free 45-minute consultation call with me about your organization's needs or particular project needs, whatever it is that you need support with. Please like and subscribe. It still feels really weird to say this, but I guess this is a YouTuber thing. Please like and subscribe. Our channel is pretty new and we want to do everything that we can to reach as many people as possible. So we really appreciate your support with that. Thank you so much for watching and we'll see you next time.